So I've been diagnosed with pancreatic cancer. It's incurable, and it came out of the blue. I did ask the consultant how long have I actually got left, and is it worth renewing my Southampton season ticket? So very brave to say that, as I'm situated in Portsmouth right now. Obviously, the consultant said that we can't give you a direct time, but I said, look, I'm going to push you a little bit here politely. You must have data that supports an educated guess. And he said, yeah, in your situation, we will look at 3 to 5 months. And that was in November. And on that day, he told me that I'd never felt healthier than I had done for years, mainly because I recovered from an operation. Maybe probably my diet was a lot better, but I felt really, really healthy. And it was quite a surreal sort of moment to, which we started the Rob's Place blog by then as well, to actually feel that you're looking quite healthy and you feel healthy and you're told you've got 3 to 5 months. One of the things that I wanted to do when I suddenly got diagnosed, like I've said before, all of a sudden a whole new chapter of your life sort of opens up, right? I'm 61 years old, and I was thinking to myself that I'm not going to make it. The final whistle is going to blow, but I'm going to try to extend my life as best as I can. But if I can leave anything behind to help someone else who's in my shoes, that can only be beneficial for a stranger that I've never met. And I've looked at ways how I can actually do that. One of the ways is taking part in research studies. So when I got first diagnosed, I was asked if I'm happy to do that. I thought, yeah, totally happy to do that. The same way I'm happy to, when the chemo doesn't work for me anymore, my body's fit enough to take part in trials. And with the research study, to start off with, it's taking a blood test to see where your blood actually is and whether that can be an indicator for someone else. All research is beneficial because eventually it will help, maybe work towards a cure or maybe work towards life expectancy. Back in the 80s and the 90s and the early sort of noughties, 2000, which I still think is yesterday, but it's 26 years ago, palliative care usually meant weeks or months because of research and because of people looking at how we can best deal with this dreadful disease. Palliative care doesn't mean weeks and months now. Okay, if the medication works for you, okay, and if your lifestyle works for you, you can extend that. But you can only do that if people are prepared to help by getting involved in sort of research programs. So that was the reason really behind why I was so keen to get involved in research. So anything we can do with my condition, which is going to extend someone's life that's walking in my shoes in the future, is a win-win, isn't it? The service I've been getting from QA has been absolutely amazing. And I think I'm qualified to say that because I started in the care business in 1981 as a cadet nurse. I've also held senior positions in other care organisations, and I've also worked for the Care Quality Commission as an inspector. So I know when things are going well and I know things are not going well. And I've run my own care business for the last 7 years. The service here has been second to none. Considering the amount of people that we are, when I say we, they are actually dealing with it, from the appointment, the scheduling team who schedule my pick flushes, to the scheduling team that schedule my chemo, always very, very calm, always get the scheduling right. If there's an issue, they let me know. When I go and get my blood tests done and my pick flushes done by the team who deal with that, the two ladies, I feel I've known them forever. They are very, very kind and empathetic. And then when we go to the chemo, sitting in a chemo chair can be one of the loneliest journeys that you actually have, because you're sitting along with a lot of people, some of them on palliative care that aren't going to make it like myself, and some are going to make it. But you know what? That oncology team, they are so calm, okay? And everyone's cancer is actually different, and they treat everyone with so much respect, and you just have trust and confidence they know what they're dealing with. And when you're receiving care, that's what you need to see. Every part of QA Hospital that I've used have been absolutely outstanding. And if I was still a CQC inspector, they would get the top grades for what I've actually achieved. And the most important thing is that they treat all their customers with dignity and respect. So you don't get scared going to chemo. Sometimes you're scared of what the chemo is going to do for you. But you know, if you leave the oncology department and you suddenly start suffering from chemo, you've got that 24-hour emergency number and you know they're going to sort you out. So my experiences have been nothing but absolute positive. I started when I was in hospital, recovering from the Whipple operation. I started putting a personal diary together, and I just called it Rob's blog. And it was really for me to look back on what the experiences that I was having. So it was one Saturday afternoon, I was thinking to myself, I was thinking about income and expenses, you know, how my income streams have suddenly changed from being able to take a monthly dividend from the business and a small wage to living off income support. And I was thinking, if I was in a standard job, a low salary, a yearly salary looks attractive. Not a lot of people today have a lot of spare income. And thought, wouldn't it be nice if we could put something together to get a sanctuary for people to have, you know, some respite care, or maybe a last holiday with their loved ones. We've carried on with the funding through GoFunding page, and we've gained £16,000 now. So where we are with Rob's Place at the moment, if we don't find enough money to buy a property by the seaside, we would downsize and either get a lodge or a caravan. The concept will still be the same, but we will make the final decision when I'm on palliative care only, and we know that you know, like the consultants will say, look, enjoy your next couple of months. By that stage, there'll be Melissa and Millie, who are helping me with Rob's Place, will make a decision, and by that stage, hopefully, we've set up you know, trustees via the charity side of things. We've got a GoFunding page for Rob's Place. We've got support from local communities, but we do need to look at different avenues. But the idea is that there could be someone out there that's living off benefits, right? And it's very, very hard to live off benefits, because it's not just, you've got to pay your bills, your internet, your food, your travel expenses. Having a break is probably one of the best things they could do for their health. And we just want to set up somewhere where people can have that place. And we call it Rob's Place. And hopefully, before I pop over to the other side, we can leave something, okay? And that was the whole idea of it. So I think it's interesting how a decision can be made. Looking back on that Saturday, if I had said, no, I'm not going to do it, we wouldn't have £16,000 in our GoFund account, which, even if I went tomorrow, would be enough to buy a second-hand caravan. You know, so that was Rob's Place, and hopefully I'll stay around a bit longer to get some more money of it. But there's people already in place to carry on that process and carry on our dream of making it a charity in the future. So they're all in place. Every single person that I have met working in this hospital has been second to none. And that surprises me, right? Because it's really hard. I've never known to be in a situation where it's 100% it is right. But the most important thing that I find as an individual is that I want to feel safe. I want to feel secure. When I come in here with an end-of-life diagnosis, I'm vulnerable. Have I got an opportunity to discuss my needs, my outcomes, what I feel is best for me? The answer is yes. The key things are with the oncology department. Staff are bubbly. Staff are friendly. It's very, very well organised, and you feel safe. And everyone I've spoken to through my blogs and my waffles have nothing but praise for that department. Not one person of all those followers, and there is followers that are around this area that are starting to follow me, have the same amount of praise. If it wasn't for them, I don't think I'd be able to be sitting here now talking, because every single person I've met has done nothing but give me the support and the strength to carry on. And in the dark moments which you get with chemotherapy and you get with your cancer journey, you know you've got all these people behind you who are totally non-judgmental, who are just there to help you feel as best as you can. I think I'm very fortunate to be living in this area to have that too.